Labral Repair with Capsulorrhaphy via Nanoneedle by Kyle Anderson. As with standard arthroscopy, a thorough evaluation of the glenohumeral joint is performed. An anterior working cannula is established, which allows for passage of the nano-sized instruments, including a shaver and drill guide. The shaver can be used to debride the labrum as well as prep the anterior glenoid rim. Through a percutaneous trans-subscapularis approach, a suture lasso can be introduced into the joint and then used to pass through the capsule at the desired length and up through the labrochondral junction. An anterior 1.8 knotless fiber tack anchor is placed 1 to 2 millimeters onto the edge of the glenoid and is properly tensioned to set the anchor. A small suture retriever can be brought through the working cannula or can be used percutaneously to pass the suture lasso as well as the repair stitch from the anchor. Once the repair suture is shuttled through the tissue, the conversion suture and this repair suture can be retrieved through the working cannula or percutaneously. The anchor is converted, bringing the repair suture through the anchor and then the tissue tightened to preference. The excess suture is removed by using a suture cutter through the working cannula percutaneously or using a meniscal suture cutter. The process of anchor placement, percutaneous suture shuttling, conversion of the anchor are repeated as needed. Alternatively, the anchor can be placed prior to percutaneous passage of the shuttle suture or lasso. Completion of the anterior labrum repair restores labral height and bumper effect. Smooth viewing sheath is then transferred to the anterior puncture and a posterolateral working cannula is passed medial to the muscle tendon junction of the rotator cuff posteriorly or through the muscular portion of the rotator cuff. Posterior labrum tear is assessed and prepared using a shaver to prepare the glenoid and remove any loose flap of labral tissue. The suture lasso is advanced through the original viewing portal or puncture to pass suture through the posterior capsule and up below the labrum at the labrochondral junction. Repair suture and the lasso are retrieved together. This can be done through the working cannula or percutaneously. The repair stitch is then shuttled through the posterior tissue. Repair suture and the conversion loop suture are retrieved the final posterior repair with 2 suture anchors in place, restoring the bumper effect of the labrum and tightening the capsule as needed. This is a clinical photograph of the patient 1 week out from the procedure using the nano needle.